today's meeting, the main outcome of it is for us to understand even better the new public health order, and to immortalize that, we have a call to action on Africa's new public health order, and with your permission, the host of this event, I will go through and read that call to action. The call to action is entitled Africa's New Public Health Order. That we, the African Union heads of state and government, heads of delegations, participating at the special side event, Africa's New Public Health Order, rejuvenating the global health security agenda in the sidelines of the 77th session of the United Nations General Assembly, mindful that Africa, a continent of more than 1.3 billion people, continues to experience the highest incidence of public health emergencies annually. Deeply concerned by the detrimental impact of the ongoing COVID-19 pandemic across Africa's health, social, and economic sectors, further concerned by the potential negative consequences of existing public health emergencies, including the multi-country monkeypox outbreak, cognizant of the challenges that African Union member states face in accessing essential medical countermeasures during the COVID-19 pandemic and other outbreaks on the continent, and driven by trade and intellectual property-related restrictions, noting the critical shortage of health workforce in Africa that is made worse by the numerous public health emergencies and challenges with securing relevant health tools for their use, recalling the African Union Assembly Decision 835 to grant autonomy to the Africa Centers for Disease Control and Prevention and upgrade the current Africa Union COVID-19 Response Fund into the Africa Epidemics Fund so as to mobilize resources for preparedness and response to disease threats on the continent. Further recalling the Africa Union Assembly Decision 735 that adopted the Treaty for the establishment of the Africa Medicines Agency, recognizing the Africa Union Commission's initiative to expand Africa's manufacturing of vaccines, diagnostics, and therapeutics, and applauding the commitment, dedication, and progress demonstrated by several African Union member states in building local manufacturing capacities, appreciating the progress made by Africa CDC's Saving Lives and Livelihoods initiative in partnership with the MasterCard Foundation, creating access to COVID-19 vaccines for millions of Africans and strengthening vaccination capacity to support Africa's health security agenda, we, the heads of state and government, hereby call for the full implementation of Africa's new public health order, which includes 1. Strengthened African institutions for public health. We call upon African Union member states to provide full support to African institutions for public health, including Africa CDC and the Africa Medicines Agency, in execution of their mandates. B, call upon governments, multilateral organizations, philanthropies, private sector, and civil society organizations to support institutional capacity building initiatives targeting all institutions that support public health at the continental and national levels. C, call upon the African Union Commission to expedite full operationalization of the Africa CDC and the Africa Medicines Agency. 2, strengthening public health workforce. A, we call upon governments, multilateral organizations, philanthropies, private sector and civil society organizations to support Africa CDC's efforts and initiatives for building the capacities and capabilities of all workers who contribute to public health in Africa. And 2B, call upon African Union member states and all partners to expand and strengthen community health worker programs on the continent of Africa. Under the third pillar of expanding local manufacturing of health products, A, we call upon African Union member states to coordinate with Africa CDC and the African Union Commission as they expand manufacturing capacity and opportunities for all health products here in Africa. B, call upon African Union member states to coordinate with Africa CDC and the Africa Continental Free Trade Area Secretariat and the African Union Commission in coordinating increased demand for health products manufactured on the continent. C, call upon all vaccines purchasing mechanisms, such as the Global Alliance for Vaccine and Immunization, Gavi, multilateral institutions, particularly those of the United Nations, philanthropies, and other stakeholders to purchase at least 30% of their vaccines from manufacturers based in Africa. D, call upon governments, multilateral organizations, philanthropies, private sector, and civil society organizations to support the removal of trade and intellectual property-related barriers to support local production of all health products in Africa. Under 4, increasing domestic investment in health, we call upon African Union member states, Africa CDC, the African Union Commission, philanthropies, and the private sector to promote innovative domestic financing mechanisms, including public-private partnerships. Finally, under 5, promoting action-oriented and respectful partnerships, A, we call upon multilateral organizations, philanthropies, private sector, civil society organizations, and all stakeholders to develop action-oriented partnership with the Africa CDC, the African Union Commission, and Africa Union member states, which are based on Africa's priorities. B, call upon African Union member states, multilateral organizations, and civil society to ensure that Africa's voice is heard and African positions on the global health security agenda are reflected in the ongoing negotiations for developing international legally binding instruments on pandemic preparedness and response. C, call upon international partners, development financing institutions, philanthropies, and the private sector to support investment in infrastructure for health manufacturing of health products in Africa through new and innovative mechanisms. And finally, D, call upon Africa CDC and the African Union Commission to strengthen scientific and technical cooperation with relevant African institutions. I submit, as this is the call to action out of this very special side event on Africa's new public health order, rejuvenating the global health security agenda. Thank you.